Cortisol has been a trending topic, especially with advice to lower the hormone that we're seeing on social media. Today I'm joined by Jacqui Fleury, who's a naturopathic doctor, who says most of the conversation misses the bigger picture. Good morning.
Good morning, Trillian.
So just to start out here, can you tell us what cortisol is and what some of the benefits are that people don't realize?
Well, cortisol is your get up and go hormone. So if we didn't have any cortisol, we wouldn't be able to get out of bed in the morning. It's a hormone that's produced by your adrenal glands. And it's that hormone that kind of kicks in when your adrenaline wears off. So your adrenaline is your fight or flight hormone. And cortisol is that hormone that helps us feel energized and alive in the morning. And then as it decreases throughout the day, it's what helps us wind down and go to sleep if it's balanced.
And then at what point is it kind of a problem for people?
Well, as you know, I do a lot of work with perimenopause and menopause, and as estrogen is dropping, what happens is we kind of lose our buffer for stress. So because the adrenal glands are the filters through which our bodies interpret stress, without the buffer of estrogen, then all of a sudden things that never used to bother us sometimes start to bother us, and that can be a sign that our cortisol is out of balance.
And then what are some of those stressors that kind of start to stack up for women, especially in midlife?
Well, certainly lack of sleep, not regulating your blood sugar well throughout the day. So if we are extending out a fast, trying to do things like stimulate weight loss, what used to work in our 30s and 40s sometimes backfires in our 40s and 50s. So it's really important to send messages to our brain and to our body that we're safe, that we're not in danger. And one of those simple things you can do is to have a little bit of protein in the morning, and that actually helps stabilize your blood sugar and helps you feel more balanced going into your day.
Some good advice there. And then any other advice you'd give to women in this phase of their life or just in other phases of their life?
Well, managing blood sugar is relevant no matter what your age is, but as we head into perimenopause and menopause, making sure that we have a constant supply of energy is really important. It's the rise and fall of your blood sugar throughout the day that triggers a stress response in our body. So that's the first thing. And then secondly, making sure that we are getting good sleep, which is easier said than done in perimenopause and menopause. So I brought a couple of nutrients and tools that can help with blood sugar and with sleep support. So for example, something as simple as adding a couple of scoops of collagen to your coffee, or I like to do a matcha latte in the morning. So that's 20 grams of protein right there. And then doing things like magnesium, theanine, which helps balance out the nervous system, a good B complex, a good probiotic goes the distance. So there's so many different strategies that are simple to do and really move the needle to support your hormones and your cortisol.
Really good advice here. I definitely love magnesium myself. I'll have to try a few other things here. Thank you so much for taking the time today.
Thanks for having me.